2018 to expand the donor base. And to expand the donor base, we proposed a long list of solutions, actually. But the three that popped out then, I mean, the clear ones were first, increase in assets contribution. That means all 194 member states to increase their membership fee. And then the second was starting an investment round. And this is a voluntary one that all member states can participate, but beyond even member states, including foundations. And the third was the establishment of the WHO Foundation to tap into the private sector, because WHO cannot mobilize resources directly from the private sector in order to avoid the conflict of interest. Of course, there were additional advices at that time or additional ideas that were proposed. One was cost recovery. We provide services, and there are services we provide to institutions or people who can pay. So cost recovery was one. And at that time, there was talk about endowment, but that was not really a clear decision then. But it was one of the options also considered. So the whole purpose of the sustainable financing, as I said earlier, is to broaden the donor base. And the member states are now supporting us with that. And as you know, the assets contribution, they have agreed to increase by 50%. And this is the second installment, by the way. The first installment was already done by member states. Investment round has generated some resources. WHO Foundation has generated some resources. Some cost recovery has been done. And our donor base actually is on the increase. And if we have endowment that will further help us in sustainable financing, especially when we talk about resources, by the way, and broader donor base, the quality of the funding improves. And it's not just about the amount of money, but it's about the quality of it, which empowers WHO. Because when the money is flexible and when it's drawn from a broader donor base, then WHO can use that flexible funding to support countries based on the priorities. For instance, support countries based on the SDG priorities, so countries can achieve the health SDGs. So the endowment, as you said, could also help. On the endowment is one thing we discussed during PBAC, an endowment of $50 billion, if we can establish that, that's what we're targeting. That could also contribute to the resource WHO will access. But that's at an early stage. We depend more on the 4 instruments, which I have already told you. And those instruments have started to deliver. So we will continue to use those instruments at hand while working on the endowment, which is still at an early stage and still an idea that hasn't moved much. But that definitely will help us in getting more resources, more quality resources that can empower WHO and help countries based on their priorities. Thank you, and Christian.
Thank you very much, Dr. Tedros. Next question goes to Sonia Wind from Bloomberg. Sonia, please go ahead.
Hi, thank you very much for taking my question. I was wondering if you could talk a bit more about the countries that might step up their funding in response to the $1 billion funding gap from the US. You could give some more specifics there. That would be great. Thank you very much.
Yeah, Dr. Tedros.
No, I cannot tell you specific countries that will increase their funding, but as I said earlier, we have this instrument. This is the investment, the assets contribution, the investment round, and WHO Foundation, and other instruments. We will use those to mobilize resources. During this challenging times, we have now 3 goals which we identified. One is mobilize resources using the instruments we have, thanks to the reform, actually, that we have instruments now. The second is to tighten our belt or efficiency gains. And the third is continue to engage the US. So it's mobilize, tighten the belt, and also engage. And we're working on all 3 fronts. And we hope the outcome will be good.
Indeed, thank you very much. I believe we have 2 more questions on the line, so we may just make it to all of them. Next goes to Jenny Leravello from Devix. Jenny, please go ahead.
Thanks so much, Christian. 2 quick questions for Dr. Tedros. Can you just clarify the endowment fund? Is it 50 billion or $50 million? And then for Dr. Kirkov, you mentioned that the US is still reporting data to IHR channels, but also you've been trying to communicate with US counterparts. Just want to ask if what kind of information are you not getting from those public information that you're trying to ask US colleagues, but you're not getting at the moment? Thank you so much.
Yeah, thanks, Jen. Not sure how much details we have, but let's get started.
Colleagues, but you're not getting at the moment. Thank you so much.
Yeah, thanks, Jen. Not sure how much details we have, but let's get started.
Okay, just very brief on the endowment. So, as you know, there are many organizations who have endowments. For instance, one example from Europe is Wellcome Trust. It has more than 40 billion, I think. And still, I want to make sure that you understand this. This is just an idea, and it hasn't really progressed much. Still an idea. And the idea is for WHO to have a $50 billion US endowment. And this could generate, as you know, endowments of 50 billion, for instance, can generate 3 to 5%, which is equivalent to 3 to 5 billion US dollars annually. I know 1.25 to 2.5 billion annually, meaning biennial will be 3 to 5 billion US dollars. So that will be a good addition to the resources or revenue of WHO, if that can happen. But it's not going to be an easy task. But one of the well-run endowments is the Wellcome Trust, which is based in the UK. But there are many other examples of endowments, by the way, and they could generate 3 to 5% annually. And but I want to again say, this is just an idea that hopefully will be realized, but we haven't still started to get into action. This is an idea that we're putting together and try to understand how we can make it happen, and hope our member states and other partners will help us realize it. Thank you.
Thank you so much. And for the second part, let's see what we could get in details from Dr. van Kerkhove.
Yeah, so I can start, but others may want to come in and supplement this. So, U.S. colleagues contribute to many different types of information exchange with us. So what I was referring to with influenza, there's data that can go on databases online in reporting systems that exist globally. I mentioned Flu ID, I mentioned FluNet, but the data that is published on the CDC website across a number of different diseases is information that is still needed for a number of different programs. But CDC and other U.S. experts also participate in advisory groups. They participate in expert network discussions where we are developing evidence-based guidance. There are meetings that have been taking place looking at different types of research for Marburg, for Ebola, for Mpox, for many different types of really critical technical outbreaks that are happening right now. And that's the exchange that we are asking to continue. So while all of these other things are being worked out, the technical exchange between scientists, between collaborators, whether this is happening at a global level, at a regional level, or in country as part of a response or as part of preparedness efforts, that's the exchange that we want to resume. But others may want to come in on that.
Thank you very much, Dr. van Kerkhoff. And I think we have time for one last question, and that goes to Gabriel Emmanuel from NPR. Gabriel, please go ahead.
Thank you so much for doing. I'm sorry to ask one more question about the US and the dynamic between the WHO and the US, but I'm really curious because President Trump has made some very specific criticisms, concerns regarding payment and leadership and such, and he has also left the door open to rejoining WHO in kind of hints here and there, saying, you know, we'll see what happens, that type of thing. I've also heard experts who've said the WHO needs to be a bit more aggressive in pursuing Trump to get back to the table. So I wanted to hear if you could respond to that critique and also say kind of what you are doing to get Trump back and to get the US back. Thank you.
Thank you, Gabriel. Let's see what we can say about this. Dr. Tedros, is that for you?
Yeah, thank you. I said the three strategic goals are mobilize resources, tighten the belt, and also engage. So it's within our own goals, and that's what we're trying to do. Of course, without formal engagement or without engagement, you wouldn't know what would really help in terms of continuing the cooperation and, you know, for the U.S. to reconsider its decision. On the issues you raised in the executive order, I can give you some examples. For instance, one is it asks about WHO's reform. Of course, we believe in reform. We believe that change is a constant. We believe in continuous improvement. And since I started, we have initiated the biggest transformation initiative in the history of the organization, and the 7 pillars I said earlier. And many of those initiatives are happening, changing the organization, preparing it for the future. For instance, our investment in science, in data, and in technology is forward-looking, and that will be game changers, and that will really shape up the organization and prepare it for the future. So we have been doing that. But still, if there is more reform idea from the US, they are welcome. We're actually asking for it. We have been asking for it. So if there are good ideas, we would be happy to take those. So I don't think this should be a reason. It should be actually a reason to cooperate. And then the other issue is payments. Of course, in the executive order says U.S. pays disproportionately. Of course, we thank the U.S. for its generosity. I know the U.S. generosity and leadership, not just as DG of WHO, but when I was working in Ethiopia as head of department, as Minister of Health, and so on. That actually helped me when I was minister to transform the health sector of Ethiopia. So I'm really grateful for that, and that's why I feel sad when U.S. is decided to withdraw, because I know its leadership and impact at country level and the same at global level. But when it does this, of course, this is, wants to help the rest of the world. But at the same time, the U.S. also benefits from it. But if the U.S. wants to pay less, it's actually in line with what we're doing as part of our reform, because we have started in 2017 the sustainable financing reform that is helping us to broaden donor base. And when this succeeds, the contribution of traditional donors, including the U.S., could decline. Of course, it will take some years, but it will decline because the burden will be shared. So if this is what the U.S. wants, then, again, cooperation and being with WHO will be the answer, meaning we're asking exactly the same thing. We're asking share the burden, and the US is saying share the burden, so there is no difference at all. And we started this seven years ago. And if there are other issues they raise, we are building a transparent organization, an accountable organization, a responsive organization, and we would respond to any queries or issues there are, and we hope US will reconsider and work with us to continue the reform that we have started seven years ago. And I think that would be actually one thing we expect as part of our goals now for the US to come back, but look forward to their engagement.
Thank you very much, Dr. Tedros, and thank you all very much online and here in the room, and to those many questions. We managed to get through a long list. Apologies to all those who we haven't managed, because the interest today was very high. We've come to the end. We will be sending the audio files and Dr. Tedros' remarks as soon as possible, right after the press conference. Any questions that may remain open, please follow up with media inquiries at who.int. And with this, back to the Director General for closing.
Thank you, Christian, and thank you also to members of the press who joined us today, and see you next time.